Hello, world. Welcome to the journalist chat. Today we have a wonderful guest, and we have amazing guests, those who have the wonderful contributions in the humanitarian response. And please welcome to our distinguished guest. Thanks both of you for being here. I'd like to say everyone when everyone is a lockdown, we think conversation is on lockdown, and we believe love is on lockdown. We believe kindness is in lockdown. So I hope like my audience will be super happy to know about both of you. So if you please introduce yourself first, Jessica, please, if you introduce yourself.
Hi, thank you. My name is Jessica Lee. I'm currently in the US, where I'm from, but I've been spending a lot of time in Bangladesh last few years as an independent researcher and analyst working on community engagement and understanding the refugee community in the humanitarian response.
Oh,
Hi.
great. It's amazing. Please.
Yeah, thank you. I thank you so much for wonderful arrangement. And this is Mhamud. I am working as a humanitarian worker, and especially I am working in communication sector. So still I am working for COVID response.
Yeah, it's an amazing, like we are like happy to introduce ourselves as a humanitarian worker. So the question is, and this is kind of sometimes people want to know, if I ask both of you, humanitarian, what is mean to you?
For me, humanitarian means to be in solidarity with a crisis-affected population and to help them rebuild their lives. And rebuilding your life after crisis means so many things. It means food security. It means hygiene, but it also means resilience and empowerment. That's what it is to me.
Okay, thank you. From my perspective, I think that having concern for or helping to improve the welfare and happiness of people, because as a humanitarian, our main target for making happy someone.
Yeah, I think this is more convenient. So, Palaj Mahmood, I know you are working the ground and you have a responsibility to work in the humanitarian response in the world largest refugee camp in Rohingya camp, and you are working in the host community. If you share to my audience a little bit about the context, what are the situations right now in Cox's Bazar, and also the response.
Yeah, it's a global tragedy and also it's global crisis because COVID-19 issue is more pandemic issue. We know everyone. But for Cox's Bazar perspective, as a humanitarian worker, also I am working for host community people, and in their community, their more threatable side is life also in the threat and livelihood also in the threat, because the peoples also as a most of the people almost 70 to 20% people, they are living extreme poverty life. So their livelihood depends on day-to-day work. As a day laborer they working, but in this pandemic situation they cannot work, they have no food. So they are thinking how they can survive in the lockdown situation. So it's tragedy for us, I think.
Yeah. So, Jessica, I know you have been working in this response for a long time, and you work in Myanmar, and you had a wonderful contributions in here. But right now, because of the situations, you are in USA. So, how you are operating your work and how you are working?
Yeah, actually, I plan to come to US for a 3-week visit, including one conference in Washington, D.C. I was going to be a panelist at the World Bank Fragility Forum to share my research that I have been doing in the camp. Of course, everything was canceled, and in the end, I had to stay here. So now it's already 2 months. So I've been working remotely. So basically, I can move forward on writing up some of my research and having calls with my colleagues in Dhaka and Cox's Bazar. But I have to just work very early morning and late night to be in touch at the same time with them.
Yeah, we all know that after the Italy, the USA is a hit zone right now, and most of the case is confirmed in USA, and every day there is a new case and new corona positive. So what about the context right now in
Yeah.
your state and where you are living right now?
Yeah, so I'm in California, which we took very early action here. And there was a lockdown a few days earlier than in other places like New York. So I think we are a bit less affected. We've been staying inside for the already. So when I started to realize how serious the situation was getting, I really wanted to contact my friends and colleagues in Bangladesh and request them to take the situation as seriously as possible. Because hopefully other countries can learn from the mistakes that were made in the U.S. In response to COVID. Basically the lesson is that you have to be more serious than you think you have to be. So I wanted to share that with friends in other places.
Yeah, if you both of you guys allow to me to share you something. So basically there is a one of the research organizations that did in the whole world. So the few point they just figure out, the one of the point is about the if I read, like, contaminating the measures are already resulting in a loss of livelihoods and the economical downturn, reducing food security, and for the most vulnerable. This is number one. And number two is tension will also be felt within households. And number three is increasing tension as the people struggle to meet basic needs will impact social cohesions. And humanitarian and development organization continue, but they are shrinking and they're challenged. So regarding that, if I ask the Polish Mhamud, you are a humanitarian expert. So basically, the topic is what the role of global peacemakers. So right now, what will be the situation? Who can play the role in the tragic situations?
Yeah, that's the vital point. And from my side, I can say there's two things. In the global pandemic situation, there are two diseases currently spreading around the world in a vital manner. And one disease is COVID-19, and another one is fake news. So the vaccine for both good information, because it's now all over the world, fake news spreading day by day, every second. So mental health illness day by day increasing. So without mental satisfaction or mental health, so I cannot survive as a human, because maximum people staying in the stay at home because of lockdown. So if they are facing and they are taking this kind of news day by day, the happiness will be destroyed. And as a peacemaker, as a development worker, as a humanitarian, we should spread positive news, and we should ignore the fake news, and also we should uh, publish the authentic source, and also we should follow the sources of news, because lots of fake news around the world.
Yeah. So before starting the conversation, basically I was asking with a few of my friends from the African BDBD camps and also the Rohingya refugee camps and also from the different camps of the world. So basically all they are talking about the access of the informations, like they are not getting enough public health informations from the actors. So in this context, what will you say actually, what can play the role from the peacemakers or how they can contribute? Jessica.
Yeah, well, I think that the lack of internet access in refugee camps is a big challenge. Some of the youth in the camp that I'm in touch with, they found some way to use internet once in a while. And every time I hear from them, they're asking me about a rumor that they heard because they have very little way to verify information they're hearing. So I've had to spend a lot of time trying to clear up these things, but it should be systematic, It should happen at a large scale where clear information is shared and rumors are dispelled. So I really advocate for, open information access during this time, everywhere in the world. And I think that's one of the most important things. But of course, even then, not everyone knows how to use the internet. So having humanitarian agencies and people like Mhamud, like doing information campaigns, it's very critical to share information, especially with illiterate people and vulnerable populations.
Yeah, I think in this context, I think is very important, like to get the proper informations. And if I going to share some comment of the on this research, like right now the situation is COVID-19 has an impact on Bangladesh garments industries as the most order or cancels, and this put high risks on the people and rely on this industry. So regarding that, it's not only happening in Bangladesh, even we know that in lots of development country this kind of things happening. So in this context, if I ask to the Polish Mhamud, exactly how do you think, like how they will contribute, because most of the operations right now turned into the another operations, I mean to fight with the COVID-19. So what will be the situation? I mean, what will be the right aftermath?
I think as a largest population in our country, and almost just we few days back, we seen a research almost 50, 17 or 20% peoples will be jobless, and they will suffer for their livelihood to ensure their livelihood. And also we also facing the health crisis because the yeah RMG sector, garment sector, we everyone know they are not much educated. They are as a employer, yeah, they are working here. Yeah, maximum people's salary is not high, but when production is getting shut down, and they how they can survive. So it's one of the major challenge for us because lots of people working in garment sector. Also few people in Bangladesh, lots of people working in agriculture sector, and this also vital point because our transportation sector and everything is getting locked down. Everyone is in the pandemic situation, they are tensed about their life, they cannot think about business and other things. Also our agriculture sectors, as a farmer who produced lots of products but they cannot sell, and how they can survive. So it's a great challenge for us.
Yeah, I mean, if I ask like Jessica, in this context, exactly like we still know that a lot of still a fund are not cut and still the project is going on. So because you are living there in a country which is a development country and you are close to know about the humanitarian operations, and I mean, what will be the situations in this humanitarian context and also the humanitarian operations? Because we know that already a lot of things and a lot of the product price already increased, and because the supply chain is not working. So in this situation, what is the major plan humanitarian response are doing?
Yeah, so I think it's too early to say how humanitarian funding will be affected by COVID, but I think it's fair to say that it will be affected in some way at some point. A lot of those funding commitments are made a year or more in advance, so it may take time for it to show up. But I think that inevitably, funding for the Rohingya response over time, it will decrease anyway. We can expect that is likely. So for me, one of the important things is to introduce some of the development activities that Bangladesh as a country is expert at, um, opportunities for self-reliance for the very poor people. So I think ultimately, in the humanitarian context for the refugee and host communities, self-reliance and income generation inside the camp, so that Rohingya don't have to leave the camp, but they can survive there without too much dependency on others. And I think that's also what they want for their own dignity. So I think that we may have to look more quickly at this kind of solution. Bangladesh has shouldered a huge burden to host the Rohingya, of course. And the funders also have been giving a big piece of their budgets to this crisis. It's an expensive, issue. So as long as the issue is ongoing, Bangladesh and international community, they have to think together. How can we still deal with this if humanitarian funding is affected by the crisis? So I'm not an economist and I'm not really the one who can say exactly the detail, but I think it's something that people need to think about. Even in my country, it's thought of as a developed country. Every 2 weeks now we go to the grocery store. Yesterday I went to buy food and there are some empty shelves. So supply
Yeah.
chains are being affected, and we just have to think and prepare for the global economy to slow down. And maybe that means that global trade will be slower for a while. And so for garment sector workers, it's very concerning. But we may have to look at how we can have more regional economic resilience if global trade is going to be negatively impacted for a while. So who knows? But we have to start thinking about it.
If I ask to the Polish Mhamud, like if you, she's talking about the regional economical resilience. So in this context, what are the situations of the Bangladesh? Like we have a really context, or we are really in a positions to deal with that?
Just from on point, World Economic Forum just public on article in Bangladesh COVID-19 threatens to cause a humanitarian crisis, and main point they given only 15% of Bangladeshi workers earn more than $6 a day. The economic shutdown sparked by COVID-19 threatens millions of livelihoods in the country humanity. So, but there are reasons for optimism. So, to not list the country's resilience. So, our threat is because as I say, in Dhaka states as a 10 million rickshaw driver, day laborer, factory worker, maids, and other people's working there, and everything is going to shut down. So it's vital point for us to survive them, to alive they can stay and survive their lives with food and daily needs. So we cannot think because it's global issue. So our economists will be and policymakers will think what should be do in this situation. It's vulnerable.
Yeah, and we know that even most of the condition, most of the crisis, though this is a kind of more than humanitarian crisis, and is something more natural crisis. But in the meantime, there is a politics. Even we heard that like the president of USA said this is a kind of a Chinese virus, and China said this is a kind of USA virus. So in this political crisis, in these political situations, Jessica, if I ask you actually, who will take the response as a peacemaker, who will take the response to make a combinations to the world, even development country to the underdevelopment country. Even still the news is going on, and we know the informations from the different international agencies about the in Myanmar there is still this problem is going on, and there's a lot of violence is going on. So who will take the decision, and who are the peacemakers?
I think the people are the peacemakers.
Okay.
I think that when I look at the so-called leader of my country, insulting everyone at a time when we need leadership and support, it's very worrying. And I think that when I talk equality and mutual support between people, everyone is beginning to depend. So I think that a lot of the support is always ignored or undervalued, but I really think we need to look at who needs support, who's having a hard time getting by with this. There will be some economic stimulus coming from some governments, but other places won't be able to do that as much. So I think the people are the peacemakers for this situation.
Yeah, I think so. There is a comment, and in our life. So King Mong is here. So he wrote like, "I'm going to share my feeling. First, I was agree Jessica view and opinions. According to the physician, social distance is very important to prevent spreading the COVID-19. How can, as a refugee, how can maintain that social distance over crowded populations in here? And there is no access to information and network, so it is difficult to get enough knowledge about the coronavirus. Who has responsibilities, and we need network to get regular update and more awareness campaign regarding virus. Why is main purpose?" If Polish Mhamud, you are working the host community and you are close to here, so if you ask, if you answer, and how you regarding that, how they will maintain, and what's kind of response is going on to make that war, what kind of communications program is going on, or what kind of content people are developing, because you are one of the communication specialists on the humanitarian response.
Okay, ISCG as a intersector coordinator working lots of, you also make few lots of contents for making awareness, because we cannot people's gathering, we cannot ensure. So it's door-step awareness system. So already communication sector already created few videos, few leaflets, few brochure, every organization giving lead, and ISCG doing this, coordinating this message, and also triple RC providing this their guidelines. And by following this, because we cannot do anything without government rules, so we follow the government rules, then we are spreading this message, which message is important for Rohingya community. And also, yeah, their language uses this message, and also the video documentary also make by their language. So I think in this pandemic situation, they are taking more take care for them, because they stop maximum activities, because if it spread, that will be unmeasurable situation. So only livelihood sector, only just food sector and health sector they allowed, and a specific area. So they are also concerned about this issue. I think we cannot do at this moment, because it's a virus issue.
Yeah. Yeah, even in these circumstances, like even itself, because it's every country facing a problem, even Bangladesh itself are facing a problem. So even here is a like very small area, but around 1 million people are living there. So in this context, what kind of prevention measure can take, like what can do from the humanitarian actors, or what will be the prevention measure, and what you are thinking about that, Jessica?
Yeah, I think first of all, I think Bangladesh and the government, they're trying their very best with a very difficult situation. And I know that some of the services have been reduced in the camp. It seems absolutely necessary to me to limit the number of people going in and out of the camp. Of course, some minimal services are necessary and all precautions should be taken. I want to remind everyone, that COVID mostly is not fatal, For most people, it's a mild illness. So, we have to think about prevention, but we also have to remember that, most people will make it and have a mild, illness if they get it. I think that in the camp, it's so crowded, so many people, and everyone is living by block. So if I was living in the camp, I would want to think about, if someone in my block gets sick, what will my block do? So I hope that, the camp authorities and majis and religious leaders are thinking also about this very local level, because if there is any illness in one block, it should, everyone should work very hard to contain in that area. So we have to think at the very local level. About every tea shop, every block, every market, how we will, try to prevent and minimize the spread. So I know social distancing is not possible in the way that it is happening in some places, but this is also true of many places in Bangladesh. So, I think there are other ways to prevent and other ways to address the issue as well, and just have to take every measure possible.
Yeah. So Palash Mahmud Bhai, like, so she was basically talking about what kind of measure preventions can take. So even it's not only for the refugees, and here is like the host community and people. The most of the host community people, they are right now more afraid, and more tensions is going on inside in the host community, even the Bangladeshi community people, because the Bangladeshi community in the Ukhia and also the Teknaf in these area, they are kind of minority as a quantity. So in this context, and you are dealing with the host community people, you are providing different kind of programs, and you are doing different kind of program. What kind of situations right now in the host community? What they're thinking about that?
Okay, especially when I visited just last week in the host communities on family, and I also talked with them, and they said they have only 2 days food in their house. So what will be the scenery? And also, the political situation, yeah, political biasness for distribution the relief is not accurate way. They are they are just comment about this issue, because without political background or something like that, they cannot getting this kind of support. So at that moment we are trying to support as a firstly we providing their awareness message door to door step, and also we provided few leaflet and soap and hand wash materials, and after that we providing them as a as a on kind of on weeks such as a few amount of money on 1,500 taka for per households, and they can survive at least 1 week or 2 week at least. So this kind of activities going on, but it's not for all. It's limited from our side, but it's a good news because I also talked with Upazila Nirvahi Officer UNO Ukia, and also he doing few planning way how they everyone can getting support from government authorization authority. So that's why it's a good sign, because also he also open a yeah on call center, on kind of call center directly she receive, and also providing this kind of materials to that house. So she doing this way, so host community people is getting support, but that tends they always way actually this pandemic situation they cannot work, so their surviving capacity is very low because they have no savings, they have no way to survive. So maximum people as a day laborer, they are staying at house. So it's challenging issue, but hope that this situation
Yeah.
will. Yeah.
Yes. So, Jessica, I know like one of the group you are like, I mean, you are operating, and there's a huge number of the people so who are talking with each other, and everyone right now we know that there's a mental health situations and people are in a stress, and people are not able to think freely because they don't know and when they will come out from the home. So exactly what how you are doing that, and what are the impact of this program, and what are the impact of this activity, exactly this kind of work, how many people can do and how they can do in creative way.
Mhm. Yeah, so I've been helping as a moderator for a group on Facebook called Distance Resistance. You can check it out. There are more than 6,000 members from all over the world, although the group is based in US. So this is just a group of people that wanted to create an online space for just social support during the lockdown, because most people are not seeing their friends, they are not seeing their colleagues, maybe they're just with a couple of family members and feeling lonely. So depression can go up, even suicide could go up. So we wanted to, have a space for people to share how their experience is going with this very strange lockdown situation, without getting too much into politics, without debating the science around the virus. We can have other Facebook groups for that, but this one is just for support. So if somebody has a need, they can come to the group and, ask for advice or look for resources. Or some people also want to offer some resource, like a free online class, free program, this kind of thing. So anyone could start a similar group in Bangladesh also.
Yeah, Polish Bhai, if I ask to you like, just right now the situations and everyone are tense like right now. Even we know that Jessica also shared with us like about the situations of the USA. People are going to be jobless, and we know this is a kind of huge humanitarian response, and huge amount of people right now they are working. So what kind of role the humanitarian actors can play, right? UNHCR, like World Health Organization, World Food Programs, and what kind of role they can play, even the world leader and the world actors, what kind of role they can play so that they will not forget the crisis inside in the ground.
Yeah, exactly. From my side and my point of view, everyone firstly for as a health, for being healthy, they need food to survive their life. So we should arrange somehow, some way, and the leaders should think what they can do. By somehow we should ensure everyone's food in their house. So if they have food, they can eat, and they will be mental healthy and also physical, because you know this virus is also taking few, when people are getting sick or they have few diseases and they are getting more affected. So firstly they should stay safe at home, but we should ensure the food. Without food they cannot stay in the house. So if they are allowed to outside, and the virus will be spread, and that will be more serious issue for us.
Yeah, I mean, this is a situations right now, people, because this is a kind of unknown virus. People don't know what exactly happening and what happening next, because the previous times we know a few informations and people try to be aware about that. And in the meantime, there's a new informations. And the last few days, we read about like there's a few new symptoms. People also the physicians and also the people those who are working on that, they get also the new symptoms of the patients. So right, you before starting the discussions, you talk about you going to advocate or you going to do a presentations in the World Bank. So what it will be, basically you are a humanitarian expert, so it's based on the humanitarians programs, or what about your research work, what you have done, because you was in Bangladesh for a long time?
Yeah, I've been working on a study. Basically, the specific topic of the study is about um, the Rohingya people, and from the cross-border perspective, that so many families in the camp are living across borders. So because of many crises in the last few years, some families have a member in Myanmar, a member in Malaysia, members in Bangladesh, members in even Saudi Arabia.
Yeah.
So our study was specifically about how families can maintain their connection to each other, especially with internet restrictions and other, long-term separation. So trying to help the humanitarian sector think about the whole family, not only the camp members, but the broader picture, and also looking at the livelihoods, if they can get any remittance or any support from the family members abroad. So this was the specific study that we were going to present the findings of. We've done it for a few months over the past 9 months. So now we may do some virtual presentation at some point.
Yeah, if I ask you, one of the things when I talk to the few people from the ground, they are talking about in this pandemic situations, the one of the things Rohingya never forget, and they will try to remind the people, those who are working, is the what happening inside in Myanmar, and it's still the peoples. And last time there was a we did the one of the report is the around 150 Rohingya try to enter in Bangladesh, and there is a problem inside it's going on. So in this in this crisis, how do you think like the people those who are working, people are advocating on the serious crisis like genocide, I mean serious issue like genocide, so do you think they're keep continuing their work, or how they're working, or how they're thinking about that?
Well, the
Jessica, yeah.
justice process and the international justice process for Rohingya, and almost every process, every sector is up in the air right now. So I would expect delays. I'm not sure, but I don't know what will happen. I mean, the ICJ, the International Court of Justice, ruled that Myanmar had 4 months to comply with certain provisional measures to stop committing any genocidal acts. But I think the 4 months is going to come up soon, and we will still be in this pandemic situation. So it's really hard to say again, exactly what the impact will be, but of course it will be affected. And then in terms of the situation for Rohingya remaining in Myanmar, it's probably very difficult for them and very limited healthcare access. But what COVID shows us is that every society is only as healthy as its most vulnerable members. So if the vulnerable people in the society don't have access to healthcare, the virus will spread much more through the whole population. So, this is something that countries have to think about, like Myanmar, who are committing these genocidal acts and denying healthcare to certain groups of people. So, I mean, this virus is a truth teller in some ways.
Yeah. So if I ask the Polish by right now, like the situations and the way you are working is not the same way you worked before. So if there are any kind of special measures like or a special announcement from the organizations you're working for, or how the humanitarians organizations, they're take caring their own humanitarians, they are taking caring their own staffs, if there are any kind of a special measure they have taken. And I heard that like a lot of people's I mean, a lot of people are stuck in Dhaka. They're not able to come, and the few of the peoples that have to work in this crisis moment. So, what kind of things your colleague are thinking about that, or what kind of special measures have taken?
Yeah, thank you. This we everyone know this is pandemic situation, and everyone should be aware on health issue, because safety security is first priority for everyone. And from that perspective, we all ensure firstly when we are going to response, just primarily when just first patient positive we found in Bangladesh, and in that situation we started about about COVID-19 awareness training for all staffs. Is step by step. It's online. We taken online. Yeah, firstly, and also they aware about their personal hygiene and safety, because it's not previous situation, it's pandemic current situation. So they are aware, and also we provided safety kits, uh, who is important and they need, and we also provided all kind of safety kits. And then we ensured never the guidelines WHO provided, and we also forward this message to ensure their active among their activities. So firstly training provided for all staff, then key messages we should follow for prevention the virus, and thirdly we provided all kind of material support for personal hygiene maintain. And then makes our previous all activities is shut down, and we just working for COVID-19 response, which we can do in the field. So it's just quite fast dependence. Then we are taking this response and following organizational internal rules regulation.
Yeah, I mean, this is the kind of hard situation. Is it the first time around the world, and people they're facing that? And I mean, the before the pandemic situations and Rohingya response and Rohingya crisis was the top of the world, and people really prioritized the issue, and people really prioritize to contribute. I mean, the country development country prioritize to contribute like the country Bangladesh. So right now they're facing the problems, but this is a question to the Jessica. And I mean, what about your understanding the country like Bangladesh and the country, the development country, that is still prioritizing to response in the crisis, response the crisis, like the country who those who were like kind of adapting, kind of responding the huge amount of people, those who are not from their own citizen. So do you think the country like USA, the country like Australia, the country like Japan, or any other country like European country, they're still they haven't if their mind to respond the country like Bangladesh, who are really facing the problems, and in the meantime who are show the best humanity to the world? Yeah,
I
what
think there
about
will
it?
be
Yeah.
the international, I mean, wealthy donor countries, they will absolutely have to think about how to keep, up some funding commitments to help other countries rebound from COVID. But I think it's too early to tell, because right now no one will make any decisions about that. Probably it will take some time, but I think the UN has an important role to play. The UN has to assert leadership and keep pushing donor countries to keep, upholding certain obligations to the broader international community, especially because our economies are so interlinked, so there has to
Yeah.
be some empathetic response. So I really hope that, there's a lot of pressure when we come out of COVID to keep supporting vulnerable populations.
Yeah, I mean, through you and through this show, if you try to give the message to the international, through the international agencies and through the other world, like we know that it's kind of very sad things happen to our garments industry. The thing is, the maximum development country and they took the order, and suddenly they just cancel it. But we are already close to the process. So because 85%, 85% of our economy and near to the 85%, the economy is coming out from our RMG. So in this context, how do you think? And as a human, even as a advocate, when you are advocating for the country and or for the people, so how you describe, how you say to the people, to the world, like those who are cancel the order, and what they should do in the sense of humanity, even in the sense of respect in the business deal. Jessica, please.
For me?
Yeah, please.
Yeah. Well, I think it's inherently fragile for the livelihood of someone in Bangladesh to depend on the behaviors of a consumer in Sweden. This is inherent economic vulnerable situation in terms of global capitalism. So if that system can ever be sustainable, that's the question we need to ask ourselves. And yeah, I don't know. I think that's the reality of this system, is that it's delicate and it depends on a lot of factors going right simultaneously. And COVID shows us that, one pandemic can easily overthrow that system that so many people are economically depending on. So we have to think about what are the alternatives if the status quo is no longer there. And the really sad and heartbreaking thing is that affects people's lives, people's livelihoods, people's ability to feed their families. So
Yeah.
It's very bleak in a way to think about it.
Yeah, the Polish by, and we know that, like, though in the world the discrimination is exists, the color discrimination, the racism, and a lot of things exist. But for the COVID-19, this virus doesn't have any discriminations and easily affected the rich people, poor people, and like white
Powerful people.
people, black people. So right now, around the world, people can feel they all are in under the same need, and they all are under the same pace. So we are close to end our show. So if you what about your comment, and what about your suggestions, or what about your opinion to the world to fight COVID-19 together?
Yeah, thanks. And we should follow the proper message on COVID-19, the pandemic situation, because everyone's firstly we should follow the source. Never be panic. Be authentic, because without authentic source we cannot spread this kind of message, because we are getting lots of messages from social media. They're sending, forwarding lots of fake news, lots of rumor in this country, not only country, in the world, day by day spreading. So firstly, our responsibility, please stop it and spread positive news. And in this situation, everyone should utilize their time in proper way. They can think and they can convert their mind another side. Suppose for learn, they can learn something from new technique, new methods, or as new things. They can study and they can see some show as like they want to do, but never be panic, because before as a healthy perspective side, for mental pressure, depression will be more harmful for us in this situation. So we should follow
Yeah.
the regular schedule, and we can uh, energize to our friends, colleagues. We should spend our time with our families and never think negative way, because hope will overcome this situation. So everyone's firstly need to support, stay at home and support others, because
Yeah, Yeah, I mean, this is all the people are talking about the stay home. So Jessica, and I hope like you are in a safe situations and you are passing your time in a creative way. So if you share to our audience, what will be your message and how you are how you are enjoying your home quarantine, and what interesting thing you used to do.
I've been using my free time here to garden and try to grow some vegetables to be a little
Wow.
bit less dependent on the food supply chain, to be honest, because I want to be a bit prepared. I am, kind of relaxed in the sense that I'm traveling much less than normal. But my heart is really with the Rohingya. My heart is with people in Bangladesh, and I'm very worried. So it's not an easy time, and I have a lot of privilege, but I'm worrying about those who don't, and for whom this is only a panicked time, and it's not relaxing at all.
Yeah, I mean, what your message to the audience, those who are watching our show, what message you want to deliver to the audience, Jessica?
Yeah, I would say we're all in this together. Some people are more affected than others, but we're all in it together, and we have to look for ways to support each other and be patient, because I think it's going to take a while. So we have to find ways to adjust to the new norm. And so, just to be patient and stay strong and, stay connected.
Yeah,
Yeah,
Mhamud, if I just came back to you, like if I say like how you are enjoying your home quarantine, or I saw all the time you are doing the work, even the it's like the same things, and what will be your message to the people and those who are following to you and those who are really need the important message?
okay, home quarantine is yeah. Last few days we staying at home and work from home, and but still who are working in development sector as a humanitarian, it's our responsibility to work and serve the people in this crisis situation. So we are working. It's almost 12 hours plus when the need, because yes, it's need to support because it's the pandemic. So firstly, everyone should respect and everyone should support who are working in this crisis situation, because our doctors, they are day by day working for to serve, and we cannot measure and we cannot think what kind of danger situation they are passing every day, every second, every moment. So we should respect and we should support them, because if they are supporting us as like previous and also in this situation, that will be more helpful for us. And in this country, in our country, few cases happen. The patient never tell their,
Yeah,
yeah, as a she he or something,
they're hiding the
hiding their
information.
information to doctors, and they doctors getting uh, yeah, home quarantine, or yeah, so it's negative things for us. So we should respect and we should follow the quality message from WHO, and that will be helpful for us, because and also we should follow our time. Yeah, as like when the message declared it's lockdown, it's not for enjoying the outside. It's not
Yeah,
yeah, on kind of previous holiday or vacation, that's kind of, because it's pandemic in our country, we should follow every rules, government rules, and please help someone who is staying with us, or with yeah, with us and with our house site and everywhere, just
yeah.
near place who are staying, and we should serve them, we should help them. And when we everyone, for our country, suppose 5 crore people surviving their lives, so everyone, just one person responsibility if take them, and that will be helpful to over this situation.
Yeah, thank you. Thanks both of you for your wonderful time with me. So, and we believe right now it is very important to show the kindness to the people, and we believe love is on to lockdown because everyone, this is one of the panic situations is going on to the people, like people psychologically, people isolating each other, people feel something negative if they know someone someone are COVID positive. So from this show, the message to the audience is, if somebody, this is not their choice, this is not the patient choice, those who are affected by the COVID-19, this is happening by chance, and this is a natural thing happen, this is a pandemic around the world. So we believe everyone, you will be keep in touch with your relatives, and you will stay home, and you will do something creative, and don't think like, okay, tomorrow the door will be open and everything will be fine, and until wait for the openness, and you have to be open the activity in yourself and inside the home, and make your home as an office, make your home as a recreational studio, as a recreational things. So, and we believe one day Jessica will come back in Bangladesh, and Mhamud Bhai also will visit to the camp, and we all will meet together, work together. And I think if we love each other, if we show the kindness, we are able to fight this COVID-19. Everyone,
Thank you.
please, thank you. And thanks, audience. And tomorrow we'll join the another show, and I hope you'll get the new message. Bye-bye. Have a good night.
Thank you. Thank you.
Thank you. Stay home, everyone. Bye.
Stay safe.
Bye. Bye.